A facelift is an operation designed to resuspend and reposition tissue on the face that has dropped through both age and laxity. A small incision is made up in the hairline, back around behind the ear, on the back of the ear, and then down along the hairline. Through this incision, the skin of the face is elevated. Once the skin is elevated, the deeper structures, the muscle, are then resuspended and retightened. This gives us a very tight, smooth contour underneath the skin. The skin is then gently redraped over this, the excess is removed, and the skin is sewn back together. It's this two-plane technique that really provides a natural look. Many patients are very concerned about having a facelift because they don't want that pulled, wind-blown, over-tightened look. That generally comes from patients who are having facelifts that are either simply done incorrectly, the tissue is pulled too hard, or from surgeons who have not done a full facelift and trying to cut corners and do a shorter facelift, and you get a relatively unnatural look. So I think that there is a lot of marketing out there today about lifestyle lifts and other types of operations. In general, all these operations will shorten the length of time of the operation, making the surgeon's job a little easier, but not really improving the long-term results for the patient. Again, a facelift is an operation that you plan on having one time, and it should be done properly. A traditional full facelift takes about 3 hours, and the recovery is only about 2 weeks. So there's very little to be gained by doing a shorter, truncated procedure. Although it may sound good initially, the long-term results simply aren't quite as nice. There are a whole variety of names out there for facelifts, mid-facelifts, lower facelifts, neck lifts. I personally perform a traditional facelift which involves both a face and a neck lift at the same time. Again, fundamentally, the operation is pulling and repositioning the deeper muscular layer of your face. During the neck portion of the procedure, the neck muscle is tightened this way. The same layer which comes onto the face is then pulled this way during the face portion of the procedure to tighten and smooth the entire layer. If you perform only one half of the operation, you tend to leave a face that's a little disharmonious. The neck or the face are tighter than the tissue next to it and don't look quite as natural. So I generally perform both operations together to give patients the most natural long-term look.